Are you considering a steroid injection, also known as a cortisone shot, for your sciatica pain? Then you're going to want to watch this video before you decide if a cortisone shot or a steroid injection is the best thing for dealing with your sciatica pain. We're going to start off by discussing what is sciatica, and then we'll discuss what is a cortisone shot, as well as a little bit about how the procedure is performed so you have an idea of what to expect. And at the end, I will give you my professional opinion as to whether or not you personally might benefit from a cortisone shot for your sciatica pain. Now, why should you listen to me? My name is Dr. Amy Konvalin, and I have a PhD in orthopedic manual physical therapy, as well as 24 years of clinical experience as a physical therapist. During that time, I have literally treated thousands of patients with sciatica, and many of them have come to me and asked, should I get a cortisone shot? Now, I admit that my perspective in life is that every tissue is designed to heal itself as long as it's moving correctly. I will also admit that when you have sciatica pain, it can be very difficult to move correctly. So that's why it's important to understand exactly what's going on with you, exactly what the cortisone shot will and will not do as you're trying to make a decision if this is the best plan for you. So let's get into it. Let's start by discussing what sciatica is. So sciatica is an irritation of the sciatic nerve. So the sciatic nerve starts from nerve roots that are in your low back that then join together deep in your hip, travel through the back of your hip and the back of your thigh, around to the side of your knee, the outside of your knee specifically. At that point, the sciatic nerve splits, and there's part of it that goes down the outside of the calf, and there's part of it that goes down the back of the calf. Many people ask me if they have pain in the front of the thigh or on the side of the thigh if that's sciatica. Well, no, it's not true sciatica because sciatica runs down the back of the thigh. However, it could be another nerve that's irritated, and the symptoms can be very similar to sciatica in just a different location. It just means you have a different nerve irritated. Now, we do have a lot of videos on this channel regarding those specific nerves, so we're going to drop some links in the comments below so you can look for those if your pain is not down the back of your thigh. However, if you do have nerve pain down the front of your thigh or the side of your thigh, and you know for sure it's a nerve pain and your doctor is recommending a cortisone injection, the rest of this video is still applicable for you. Because just because a nerve travels down a different path, the properties of a nerve and a nerve irritation and nerve inflammation is still the same if we're talking about the sciatic nerve or another nerve. Okay, so if you're going to get a cortisone injection or a steroid injection, or the doctor may have offered you one and you're trying to decide if that is going to work for you, let me explain what a cortisone injection does. They put the cortisone injection into your back in order to decrease the swelling and inflammation that is occurring around the sciatic nerve. So what happens is when the nerve roots come out the side of the spine, they can get irritated or bathed in inflammation. And this can cause an irritation that can then go all the way down the back of your thigh and even down into your foot. So the idea is that a cortisone injection will help to decrease the inflammation, which will then decrease your symptoms. Now, will this cure your sciatica? It's important to note here that a cortisone injection will help to decrease your symptoms for a period of time, usually between 2 weeks and 3 months. However, it won't deal with the root cause that caused the inflammation in the first place. So whether or not you get a cortisone or a steroid injection, you want to make sure that you are working with a manual physical therapist who can help you understand how that inflammation started in the first place. Because once you get the cortisone injection, you want to get your body moving correctly so that that inflammation doesn't come back. And that's what a lot of people wonder about, is how long does a cortisone injection last? Well, Cortisone is a medication, so it goes directly into your body and it decreases the inflammation. Sometimes it can take 2 weeks to take effect. It depends on how much inflammation you have. However, it will wear off over time, just like any medication does, which means if you haven't dealt with the root cause of what started that inflammation in the first place, then you are going to have more symptoms in the long term. And this is why people may have told you, oh, I had a cortisone injection, but it wore off after 3 months. Well, every cortisone injection wears off after 3 months. However, it's a matter of did you deal with the root issue so that your symptoms don't come back. So people who get long-term benefit from a cortisone injection or a steroid injection are ones who dealt with the root issue. Let me explain how this will play out in my clinic. If I have patients who have a really hot sciatic nerve, so it is super, super irritated, and they come in for the evaluation, we look at what is actually increasing their symptoms and what is decreasing their symptoms, which means that after they get the cortisone shot, then we make sure that they avoid all the activities that are increasing their symptoms until we can get normal movement, so that way they're not aggravating things. And unfortunately, I have a perfect story to illustrate this. So I had a patient who I was working with who had sciatica symptoms. We did the evaluation and very clearly understood which activities were increasing his symptoms and which were not. Now, before he came to see me, he had already signed up for the injection and he wanted to get the cortisone injection. My one caveat was, please let me do the evaluation first, because once you do that cortisone injection and you eliminate that pain, then I'm not able to see which motions are aggravating and which are relieving. He agreed to that. So we did the evaluation and then he went in for the cortisone shot. And then he came in for his first appointment after the evaluation, or second appointment overall. So what happened? When he came in for that appointment after the evaluation, he told me that the cortisone injection had worked wonders. And he had woken up the day after the cortisone injection and all of his pain was gone. And he thought it was miraculous. And he was so excited that he went out and did 8 hours of yard work. Now, I will tell you that forward bending or forward flexion or bending over to do things like raking and pulling weeds and lifting leaves and all of those things were his aggravating symptoms. You probably will not be surprised to hear that all of his symptoms came back the next day after. So when he came in for his next appointment with me, he told me that the cortisone injection doesn't work. What I hear from that story is that the cortisone injection did work and that it decreased the inflammation and eliminated his symptoms. However, because he didn't have any symptoms, he went and did those activities that were aggravating instead of staying on more of the relieving type of motions while that sciatic nerve was finishing healing. So it's really important, if you're going to get a cortisone or steroid injection, that you know which activities are aggravating and which are relieving so that you stay in the relieving activities once the pain's eliminated. All right, so how is it performed? It's a little bit different in different locations, and of course every doctor has their own protocol of how they're going to do it. But basically what they're going to do is they're going to have you come in, they answer some questions, get you all ready with the nurse and everything like that. They'll take you into the room, they'll have you lay on your stomach, but you don't have to lay flat on your stomach. Usually they have an ergonomic setup so that you feel really, really comfortable. You won't have pain while you're laying there. And then they're going to inject the cortisone via a needle using most commonly fluoroscopy. So this helps them to be able to visualize exactly where that needle's going in. And of course, they're going to decide where they want the needle to go in based on your MRI results, most commonly. Now, there are still some doctors that look more at the symptoms that you report that you're having. We call those the subjective symptoms, and they will decide on their placement of the injection based on that. But many doctors nowadays want to have an MRI so they know exactly where they should be injecting, and that's what they will do to determine where to inject with the needle. The procedure doesn't really take long. They're really good at getting you through as quickly as possible. You will get up off the table and usually need to go to a recovery room and wait for a period of time before everything to just calm down and need to get your head about you before they allow you to leave. Usually the procedure does not take very long, and there's very little risk of complications. Now, if you're putting a needle into the skin, of course you can have complications, and I understand that that can happen. It is pretty rare. I will say, of all the patients I've seen who have had a cortisone injection or a steroid injection, luckily, praise God, none of them has ever had a problem with any kind of infection or anything like that. So it is very rare. I will say there will probably be comments below of people who did have that problem. It is possible, but I will say it's pretty rare. Now, a lot of people want to know, is this injection dangerous because the needle is going to be close to the spinal cord? I will say that the needle does get somewhat close to the spinal cord, but due to the fact that they use the fluoroscopy, they can see exactly where that needle is traveling. So they're actually going to stay outside of the spinal cord housing most commonly when we're talking about a steroid injection. And they're going to focus on the nerve roots. So the nerve roots are the ones that come out from the spinal cord. They're not in the center where the spinal cord is, they're out on the side. This makes sure that there's bone in between the nerve root and the spinal cord. Plus, again, they've got that fluoroscopy, so they can see exactly where that needle's going. Now, I will say that some people get an epidural injection where they're going to put that cortisone directly into the spinal cord. If that's what your doctor has recommended, yes, then obviously they are going to be close to the spinal cord. But again, most commonly, they're going to use that fluoroscopy and they're going to be able to see exactly where that needle's going. So again, I will say I don't know anybody who has had a problem after having a cortisone injection with any kind of spinal cord issue or even a nerve root issue. It is a relatively safe procedure. And I know as I say that there are always exceptions to everything, but if you have specific concerns regarding your body, maybe you have some bony abnormality or something like that, then I would really encourage you to talk to your doctor specifically regarding your symptoms and what's going on with your body until you feel comfortable and safe getting the injection. Will it relieve your sciatic symptoms? This is what everybody wants to know. If I'm going to go through all that hassle, will it relieve my symptoms? What I will tell you is that it will decrease the inflammation that is happening around that sciatic nerve. So for most people, they will get relief of symptoms for approximately 3 to 12 weeks. Now, how do you maximize the symptom relief and even get it to last longer than 12 weeks? That's making sure that you do not have abnormal movements that are then increasing the inflammation after you've had the injection. So I would say that the cortisone injection may feel like a magic bullet because it does help to relieve symptoms and it usually does it pretty fast. However, what I will also tell you is that the symptom relief is not going to last if you continue to do the movements that are aggravating to your back. This is why it's really important to make sure you're working with a professional, a specialist who understands specifically what's going on with your body. Because the truth is you don't want to have to get cortisone injections for the rest of your life. And in all honesty, the doctors are only going to give you so many per year anyway, so it's really important to deal with that root cause. And this is what I tell my patients or people who call here Physical Therapy for Everybody and are wondering if a cortisone injection will work for them. I can tell you in the vast majority of cases, it does help relieve symptoms for a period of 3 to 12 weeks. There are exceptions to that, as I told you earlier about the story about the gentleman whose symptoms came back after 24 hours. Which is why it's important to work with a specialist who knows your body and can advise you on the best route forward. Now, if you have sciatica, do you absolutely need a cortisone injection? Well, the truth of the matter is your body is perfectly capable of healing itself as long as everything's moving correctly. And this includes the sciatic nerve. Most commonly what happens is that the sciatic nerve gets irritated because of the inflammation around it. Is your body capable of dealing with that? Yes, it is. Even if it's a disc that's pressing on that sciatic nerve and that's causing your sciatica symptoms, the body is capable of reabsorbing that material and eliminating your symptoms. However, if your body is not moving correctly, then it will not be able to heal itself. And if you have extreme symptoms that are keeping you from sleeping correctly, then again, your body is not going to be able to heal itself. And this is what I would say is the one caveat I have to everything. If your sciatica symptoms are keeping you from sleeping correctly, even when you're trying to move correctly throughout the day, you're minimizing any abnormal movements that increase your symptoms, then I definitely would say that a cortisone injection will help to decrease the inflammation, which will help you to be able to sleep so that you can actually get that healing that your body is capable of. But if you're not sleeping, you're not healing. So this is a caveat I always give my patients, that you need to do what you need to do in order to be sleeping correctly, because that's when your body's healing. All right, so we covered what the sciatic nerve is, what a cortisone injection is, as well as how it's performed, and discussed who it might or might not be appropriate for. Again, I hope you clearly heard the caveat that I want you to be working with a specialist to make sure that you get the maximum benefit from a cortisone injection. And if you are a specialist who lives in the Maple Valley, Washington area, and you would like to work at a clinic where you have time to have these conversations with patients and really explain these types of issues to them, I'm going to encourage you to reach out to me directly by sending me an email at dramy@pt4eb.com.